Hi, my name's Liam McGiveron. I've been a doctor for just over 2 years now, and I'm currently I've just started my paediatric training.
How many hours do you work per week?
So you're normally contracted for about 37 and a half hours a week. And if you're doing a normal week with no on-calls, that's what you'll do. So you do about 8 hours a day, 5 days a week, and you get half an hour break each day. It does vary though. So if you're on call, you'll be doing 12 or 12 and a half hour days. And sometimes you can do up to 4 of these in a row. So it can vary between 40 hours a week. Sometimes I've done 55, 60 hours in a week.
How can you get good voluntary work?
So I suppose it's a bit difficult in a couple of ways at the moment, but voluntary work doesn't just have to be in a hospital. So a couple of things I did was I was a voluntary shopper and did shopping for people who couldn't get out the house. I also worked at other organisations such as MenCap doing other things like that, and there's plenty of places where you can do that kind of voluntary work. Being in a hospital obviously is ideal. You'll see what doctors do firsthand, but it can often be quite difficult to get that voluntary work, and it's not the only type of voluntary work that it looks good on an application.
Do you struggle to switch off?
Sometimes, when in your first year as a doctor, you actually don't make that many decisions yourself, so it is quite easy to come home and just switch off, because ultimately the responsibility isn't yours, but you have kind of done the treatment. As you get more senior, so when you go into your second year as a doctor, you do start making decisions, like you start sending people home from A&E. People start calling you for advice and will act on that advice. And then once you start your specialty training, people do call you and say, what should we do with this patient? And sometimes, especially recently with starting specialist training, it is harder to switch off because you do worry about the decisions you've made. It's easier said than done to just come home and forget about the patients. You can't really always do that. But everyone has their own little ways of forgetting about work.
Are some hospitals easier to work at?
I've only worked at 2 hospitals, so I'm still quite junior in my career. But from working with other doctors who've worked at a lot more hospitals than me, pretty much all of them say the job's the same wherever you go. It's still medicine. So it's not necessarily easier or harder to work in any particular hospital. One of the things they do always comment on is kind of the systems, the computer systems that are used, how things are prescribed, how we order investigations, and the protocols. They're different from hospital to hospital. Once you get used to that, and once you know how to access those things, it's pretty easy kind of switching from job to job. So work at each hospital, it's pretty much the same.
Can you give me 3 bad things and 3 good things about working as a doctor?
So I suppose one of the bad things about working as a doctor is, and everyone says it, the work-life balance. Sometimes you're in 5 days a week, 9 till 5, and you get your weekend free, and that's great. But most of the time, actually, you're going to be on call, maybe 1 in every 3 or 4 weekends. You're going to do nights as well. You do miss out on things. You do miss out on, family events, life events, even small things, just like, your mate's saying, do you want to go out at the weekend, and you can't because you're in work. It doesn't happen often, but it does happen. And there's a few bigger things as well that may have to be delayed if you want to kind of progress quickly up your career as a doctor. I suppose one of the other things as well is that there's going to be a lot of times when you're placed in a difficult situation where you don't necessarily know what to say to the patient, and that can be, you know, everyone gets asked by patients at some point, am I going to be okay? Am I going to die? And you have to answer that. You know, you have to kind of, you know, reassure them or be realistic with them. You know, we say manage their expectations. And also there's a lot of situations where you just actually don't know what to do. And it feels like you're on your own. There's always someone you can call, but it can be quite difficult. And I suppose the third kind of like negative thing is it is genuinely quite hard work, especially when you're starting at medical school. Kind of the sheer amount you need to learn is quite daunting, and it never stops. Like you're never gonna know it all, which I suppose, you know, can be a good thing and a bad thing depending on, you know, if you like to learn all the time. But it is hard work, and being examined never stops. You always, it's a career where you're always going to have to do exams. However, moving on to the good things, it's one of the jobs where you genuinely feel valued by patients and your colleagues, and your family. You know, family are always commenting, saying, oh, you know, they're always proud of you and things like that, which is nice. And even friends saying, oh, you know, silly things like, oh, I don't believe I'm friends with a doctor and things like that. It's all silly things, but it makes you feel good for what you're doing, which is nice sometimes when you've had like a hard day or a hard week or whatever. And I suppose another thing everyone always says is that it genuinely doesn't get boring. No 2 days are the same. Even though you might be on the same ward for 4 months, 6 months, there are always different patients, there's always different problems to sort out. Which is good, you know, you're not going to get bored being a doctor. And I suppose what the final good thing I can think of that people don't really mention much is that that kind of like guaranteed career progression as a doctor. You don't get it in many jobs nowadays, but you're guaranteed, you know, as long as you meet all the targets, and once you're qualified, the targets aren't really that hard to progress. You're guaranteed to move up that ladder quite quickly, and get to where you want to be. So yeah.